So good afternoon, everyone. I'm Karen, and these are my co-founders, Justin and Andrew, and we are OssFila. So imagine a patient with a skull defect requiring cranioplasty. Could you imagine what would happen if the implant didn't fit and integrate well? Infections, fractures, leading to coma, or even death. Imagine the consequences. And these are actually the problem with generic implants. So perfect fitting of implant is always a problem for standard procedures. And more importantly, in some cases, we can simply could not find any standard implant available to patients. So customized implants is a solution to these problems. So while there is a need for customized implant, there is also an increasing market to customized implants due to aging population, especially in China. Well, there is due to the advancement in additive manufacturing, we can now produce a 3D prototype implant like this at a very low cost. And therefore, the number of 3D printed implants is expected to have a 7-fold increase over the next 8 years. And currently on the market, there are several leading manufacturers offering 3D printing solutions using titanium, PEEK, and PMMA. These kind of materials have very good mechanical properties for orthopedics applications, and they are also bio-inert. However, materials like titanium and PEEK is often associated with very high manufacturing cost. So here we present our solution, OssFila. OssFila is a filament that is made of our patented hydroxyapatite coated PMMA nanoparticles. And empowered by nanotechnology, our materials have enhanced mechanical properties compared to conventional PMMA. Also, the manufacturing cost is lower compared to titanium and PEEK due to its low melting point. And most importantly, our materials is osteoconductive. It has been demonstrated in animal studies that we can see superior engraftment and assimilation of our implant into the host bone. And we can see very clearly here that on the CT scan, there are more bone infiltration to our OssFila implant. So with our material solutions, we believe we have an impart an advantage over other current products currently in the market. So our projects involve 4 stages. First, the material development stage is completed, and then we'll move on to our formulation development using our materials and also adding biodegradable polymers. And then we'll extrude the material into filament, and this is where we need capital investment on our machines to accelerate our progress. And after that, we will provide 3D printing services with our filaments for prototyping and research purposes. And ultimately, we would like to build our customized implant using MRI and CT scanning. So we will have 3 key business channels developed. And first, we will sell our OssFila filament as a product by the end of this year, hopefully. And then we will assist our clients with prototype printing using our filament. And then finally, we'll produce tailor-made implant for vets and clinicians. So to conclude, our vision is to provide patients with a therapeutic choice that could help reduce postoperative pain, speed up recovery, and achieve greater range of motion after surgery. And while providing clinicians with greater flexibility on implant design, with reduced surgical time, and at a comparable cost with traditional implants. So as we are a team with multidisciplinary background, with expertise and network connections, we believe we can successfully
yes,
launch this.
Thank you, Karen. Yes, any questions from the judges?
Where is your IP? Is it in the materials, or is it in the coating, or is it in what? Or do you have any IP here?
The materials, the nanoparticles is under the IP on the fabrication and also the materials. On the fabrication mainly.
You have that?
Yes. We are in collaboration with a company, and we own this.
And is PMMA the only one, or you're just using that as an option?
It's probably the option, one of the options for the company. But in this project, we'll be focusing on this material.
Last question from me.
Yes.
can you explain how this can be durable and how this can be considered strong using hydroxyapatite on the PMMA?
Because this is for the application of extruding and filament, and we believe that because PMMA itself, if we extrude from a bulk material, then it will there may be some air bubbles, and there will be a lot of way to optimize the condition to make it strong. But with the nano-sized particles, and the materials can be packed more closely, and then it will improve the mechanical properties of the filaments and not to break during the 3D printing applications.
Okay, two questions for me. Clinical trial has been carried out, and the necessary regulatory authorities' approval of using this implant. Can you update the status?
Then maybe I can.
So right now we're in the phase where we're still developing the material into a filament, and in terms of clinical trials, actually it's a much easier process because it's a customs device. So actually, according to the FDA, they have released reports on custom devices where actually you're allowed to be exempted from the pre-market approval and 510K process. So actually, the regulatory process is actually much simpler if we pursue this path.
Titanium and the PMMA is a different purpose. Are you getting into the PMMA, using PMMA to getting into the titanium strength?
Sorry. To getting into titanium strength?
Right.
No, actually, well, there is, although titanium has very good modulus, but then in other application it's not the best because the modulus is too high compared to bone, and that will raise other questions, other problems like stress.
Okay, then what is the problem of current PMMA?
Current PMMA.
What's the problem with the current PMMA materials?
Okay. It is not osteoconductive enough, and with the addition of hydroxyapatite, it is bone can easily grow on the surface and also into the implants. That is what we are aiming. We hope to have a better integration between the implant and the natural bone. So that's why we added hydroxyapatite. So that to induce.
Can you with the other like a bone cement type of other things?
Sorry?
Are the other material in between implantation and the natural bones? If the interface is a problem?
Yes, sorry, time's up. Okay, thank you, Karen.